Huh? All right. All right. So the first thing I'm going to point out is that this group never removed the respiratory system from their specimen or their heart. So it's going to be a little harder for me to show you. However, right here, this is the trachea right here. The trachea has these little rings. They're cartilage rings. And those cartilage rings, what they do is they prevent the trachea from collapsing. Because if the trachea collapses, the air won't go through. So if you press on it and you let go, it comes back up, you see? And it keeps it always open. So those rings are what do that. If those rings were not there, your trachea will collapse and you will die, all right? Now up here, and now I'm gonna be talking from a human perspective, okay? Up here, this is part of the larynx and the pharynx, okay? The pharynx is the spot where your nose and your mouth connect back there. That's why you can breathe through your nose when your mouth is closed and vice versa, right? Then when it becomes one tube, it becomes the larynx. I mean, a little lower. The larynx is where your voice box is. Your voice box is where your vocal cords are. Your vocal cords are not what lets you speak. It's what gives you your voice. Because your voice is based on vibrations by the vocal cords. As air is coming out, your vocal cords vibrate, okay? And they're in here. If your vocal cords get swollen, you get laryngitis, right? It's a swelling of the larynx. That's why it's called laryngitis. And then that's why you talk like this. Because there's no vibration from your vocal cords when they're swollen, all right? So then at this point right here is where your trachea and your esophagus, which is right here, which makes me wonder, okay? That's where your trachea and your esophagus, you see trachea, esophagus, that's where they separate, all right? Now, because this one is not removed, you have yours?
Yes.
Can I have it? The lungs with the trachea. So anyway, so right here, where the trachea and the esophagus separate, there's going to be a piece of cartilage that I'm going to point at in the ones that are removed, and that is called the epiglottis. Can I borrow this, Robert? And that cartilage, you see, this is what you're seeing here. All right, so that cartilage will be up here. And what that cartilage does, it's a piece of cartilage, when you swallow, okay, when you swallow, that piece of cartilage is going to close the trachea, all right? And when you are breathing, then it opens the trachea and it closes the esophagus, all right? So it's like a little door and it's made out of cartilage. Your lungs are separated into lobes. These are these pieces of your lungs, all right? And down here, this muscle right here, it's a very thin muscle, and it's a muscle that contracts to pull your lungs down so air gets into them. The same is gonna be for the intercostal muscles. These are your ribs. Intercostal muscles are the ones in between the ribs. And those are the muscles that then pull your ribs so they go up. And that also pulls your lungs so they get more air. So your lungs are being pulled in that direction and in that direction. And that's how they fill up with air. Your heart, look, you have a blood vessel that is coming from the bottom of your body, which is called the inferior vena cava. There's not much left of it, but it's right here. And then you have one coming from the top, which is here. You see? This one's coming from the top. This one is coming from the bottom, but they both connect to each other and enter here. So based on that, the fact that this is the superior vena cava and this is inferior, what chamber of the heart will this be?
Left ventricle.
Huh?
Left ventricle.
Remember, blood enters the heart through
Atrium.
atria. And on which side of the heart does it enter?
Right.
The right side. So this will be the right atrium. It's important that you recognize the vena cava, because if I point at this right here, you have to be able to identify if that is the right or the left atrium. Okay? The dark ones that are small are the atria. You see, there's this one here and this one. You have two of them. You have to be able to identify which one's which. Okay? Now, obviously, these bigger, more muscular chambers, these are the ventricles, because those are the ones that have to squeeze blood out of the heart. All right? Now, focusing on that, if you look here, this right here, that's the aorta. All right? This right here is the aorta. The aorta is the main artery that leaves the heart to supply blood to the rest of your body. So the aorta is coming out of this huge chamber, which is the largest one of the heart. So if you find the aorta, this chamber B.
Left. Atrium. Ventricle.
Left ventricle. Remember, blood exits the heart through ventricles and enters through atrium. The atrium are smaller. These big ones are ventricles. So blood comes out of the aorta through the left ventricle. Okay? So that takes care of those. Now here is the liver. Now the liver is going to have two main blood vessels entering it. One blood vessel coming from the heart, which is called the hepatic artery, and one blood vessel coming from your intestines, which is called the portal vein. Portal as in P-O-R-T-A-L. Okay? So why is it that blood leaving your intestines goes to your liver first? Because what's the job of your liver?
Filter toxins.
Filter toxins and process everything that goes into your heart. Here, right here, this tube right here, that's actually the portal vein. Okay? In these pigs, for some reason, I can't find it. But so, anyway, you see this little organ right here that looks like a leaf? That's the spleen. The spleen is part of your immune system. Okay? Now, right here is the stomach. The stomach has something called the upper curvature. Then it has the greater curvature, which is a big turn at the bottom of the stomach. This is a greater curvature, and this is a lesser curvature. Again, this is the upper curvature. That's where burps accumulate. Okay? Then this is called the greater curvature, and this one here on the top is called the lesser curvature. Okay? So, under the heart, under the stomach, you're gonna find this organ right here that is kind of wrinkly. That's the pancreas. Okay? And the pancreas obviously releases insulin to lower your blood sugar, and it releases glucagon, the hormone that will go to the liver, so your liver can release the stored sugar there, so it can bring back your blood sugar. Okay? So when food leaves your stomach, it's going to enter the small intestine. Now, as you can see here, this is the stomach, and this is where food enters the intestine. In humans, this first turn of the intestine is called the duodenum. It's one word, duodenum, okay? Then you end up with the small intestine. Now, I don't know if you noticed, here's the portal vein, by the way. Okay? Now, I don't know if you noticed that the intestine is not just a tube that is loose in there. The intestine is all connected. You see? They all have all these blood vessels through this kind of like see-through net. It's like a web. And they all connect right here in this. Okay? This tissue that I'm going to ask about, this tissue that is kind of see-through with all those blood vessels, that's called the mesentery. Okay? The mesentery is where all the blood vessels that carry the nutrients that are extracted from your intestines go. And then it also brings nutrients to the actual cells that make your intestine, right? Because if it's made of cells, it's going to need also those nutrients. So they all connect into the mesentery artery, and that connects to the portal vein, so it can take the blood to where? Huh?
Liver.
The liver, okay? Now, in case of the pig, and I know this doesn't look like the other ones, but this is your large intestine. You identify the large intestine because it's wider, not because it's longer, okay? So that's this one, the dark one. Now, the spot where the large intestine connects to the small intestine, which I'm looking for right now, which will be, oh, I can find it here. Anyway, the spot where the small connects to the large intestine. Let me see if I'm following. I'm following. Okay, it will be right here. All right. I don't know if you can see it, but the small intestine is coming through here, and then it connects right here to the large intestine, which goes. Okay. That spot is called the ileocecal joint. I will ask about it. It's called ileocecal joint because the end of the small intestine is called the ileum, with an E, I-L-E-U-M. What's the matter? Is it this?
Yeah, it's pretty
Okay.
nice.
And then the beginning of the large intestine is called the cecum, C-E-C-U-M. So that's why the joint is called the ileocecal joint. In humans, and the cecum, that's where your appendix is. All right? So, remember, mesentery, here's the pancreas, here's the stomach has the upper curvature, then you have the greater curvature at the bottom and the lesser curvature. All right? When the intestine starts out of the stomach, that's called the duodenum. This is the liver, and the liver has blood coming from the heart, which is called the hepatic artery, and blood coming from the intestine, which is the portal vein. All right? And again, you have the heart, you have the lungs. Make sure you study those, and what you're going to do right now is extract the kidneys with the ureters, okay? And that's it.